Hello, everyone. Welcome to the session today. This is our second educational webinar session in the Awesome Breathers Club. And I warmly welcome you all again. And I hope everyone is safe attending this online webinar today. And today's topic is managing your lung disease beyond COVID-19. And I'm just going to shut down my video and share my screen to commence your session. So, as I introduce our topic today, it's managing your lung disease beyond COVID-19. So our topic is going to today focus key subjects would be how you're going to manage your lung disease and also the COVID-19 symptoms. So our learning outcomes at this end of the session would be you identifying how you are going to take care of your lungs and also your loved ones around you. So, as we all know, COVID-19 is a respiratory disease and it is causing a multi-organ disorders as well. So the virus spreads by droplets from person to person through coughing and sneezing while in a close contact with an infected person. And the symptoms appear within 2 to 14 days after the exposure. So what other common symptoms we are almost aware of with all the guidelines and other things getting updated with all the medias through our networks. So the common symptoms are fever or chills, cough, sore throat, congestion, runny nose, shortness of breath, headache, muscle ache, fatigue, nausea or vomiting, changes in loss of smell or taste, and diarrhea. These are the key features or symptoms you might identify with anyone infected with COVID-19. Though these symptoms might actually mimic the symptoms of the chronic lung disorders, like fevers, cough, congestion, shortness of breath, but these symptoms will be more aggravated in people with chronic lung disease. So you need to be very vigilant whether your daily normal symptoms is being exacerbated with higher levels of temperatures, consequent to 3 days, and cough, congestion, shortness of breath, a headache or muscle ache. Its immediate alarm should be that test for COVID-19. So what does our UK statistics on COVID-19 actually exposes? We are actually having a higher increase of COVID-19 in the past couple of months, and with the lockdown unveiled in around May of this year, and people have been on all are exposed to the crowds and all of them the travel and everything. We have our recent statistics taken, as you can see on the slides. In England, United Kingdom, the last week statistics, the deaths have been recorded as 1,424. The highest recorded of deaths compared to the July 2021 statistics. And when we compare our worldwide increase, United Kingdom has been recording a new cases in the past 60 days. There is you can see the graph getting increased, and it is actually giving us an alarm whether we are going to experience another lockdown, or whether we have enough sufficient healthcare resources to protect our own people, and how we can protect our loved ones and ourselves from the COVID-19 symptoms, how we can support and manage the healthcare systems to be more safer with out of the symptoms of COVID-19. So in the next slide, I'll be actually discussing the ethnic minority groups have been affected and the statistics, what it actually speaks about. So the age-adjusted ethnic mortality has been exposed in the 31st of July 2021 statistics. You can see that the Asian group have an higher number of deaths being recorded in 7.1 in the age-adjusted mortality rate in July 2021 compared to the other ethnic groups, and especially 7.1, and also along with that Asian minority groups, the Black and Black British also rank as a higher mortality rate of 8.4. So when in comparing to statistics exposed by the CDC, Center for Disease Control, again, there is a similar data being exposed. Non-Hispanic American, Indian, or Alaska Native been having a higher risk of mortality rate in their ethnic race groups compared to the other ethnic or race groups. So how we can actually assess, like, we are not going to get rid of COVID until and unless we are being practicing a safer healthcare guidelines, and how we are going to manage if you are being contacted with the COVID-19. So how you can actually assess whether you're in a risk category of COVID-19. Any of the long-term chronic lung disease, or any of the people having immunocompromised conditions are more at a risk of COVID-19. The examples are given here on the slide. Anyone having a long-term condition of diabetes, anyone having a chronic obstructive pulmonary disease, which actually encompasses the umbrella term for any chronic bronchitis, emphysema, or asthma, or any cardiovascular disease, or people with conditions of obesity and cancer, any kind of cancer, anyone who is actually undergoing chemotherapy as a result of the cancer. Those people are very immunocompromised and very much exposed to the risk of COVID-19. And also people being in close contact with the family members or a work colleague or a peers in your groups who have been contacted with the COVID-19 infection. There need to be a social distancing definitely to be practiced within family or outside family, because we will be put under risk of a close contact with a person who have already been exposed to a positive COVID symptoms. If they are actually having the positive COVID symptoms, it is safer if they have been actually isolated and follow the guidelines and there is no symptoms of the COVID-19, that is fine. But if they are having a symptoms of COVID-19, they are putting us at risk for you getting into a COVID-19 as well. And a population about the age of 60, the older adults are more at a higher risk category of contracting COVID-19. So what we need at the moment is a real heroes every day. So we are real heroes if you're going to practice the safer guidelines of COVID-19. And as you can see in the slide, it is a WHO has actually popular. I love this fact sheet, so I actually put on in the slide here. So WHO fact sheets actually clearly says what you need to be doing in terms of practicing guidelines to protect yourself and your loved ones. So any of coughing or sneezing activities should be, you have to use appropriate measures, either with your elbows or cover it with a tissue and dispose the tissue appropriately in a safer bin, rather than putting it in your pocket or throwing it on the roads. And also close contact with someone sick, like hugging or shaking, should be prevented. And COVID-19 virus seems to be not only spreading from person to person, it also been identified that the virus can stay alive in the objects or surfaces. So it is a best practice to clean any of the objects you're in contact with, like doorknobs, or your tech devices like laptops or mouses, lift buttons, digital devices like your mobile phones and pens, etc., can be having carrier of the virus strains, and it is best practice to wipe it with give a good wipe with alcohol wipe, so that you're being protected, increasing your protection levels out of the COVID-19. And also reduce your risk of COVID-19. There are a couple of things which you have been repeatedly hearing on the media, and I'm going to just speak up that same thing here, even if that's going to sound repetitive. And that is the only way we can go forward to handle the challenges of COVID-19. The first thing is to clean your hands often, and also to practice a good washing hand technique, 5 techniques of the hand washing, and wash it for 20 seconds with warm water, and not hot or not cold. And avoid touching your eyes or nose and mouth with your hand in terms of when you're going out in the shopping center and touching a few objects, and you suddenly feel like itchy around your eyes, your temptation would be to bring your finger close to your eyes. So please do avoid that. It is a best practice to avoid that. Rather, go to the washroom, wash your hands with soap, and then touch your eyes, or you can use your elbow or your cloth or your shirt. So that's the best way to handle that. And any kind of social gathering, it is best practice to avoid the crowds, and definitely wear a mask. And avoid close contact with someone who's at risk of COVID-19, for example, immunocompromised, as we discussed in the previous slide, or people with older age category with immunocompromised, and people who have been recently discharged from the hospital. So those people put as a potential risk for you to get contracted with COVID-19. So just to maintain some a good amount of social distancing and no close contacts. And clean and disinfecting frequently, touching the objects, as I explained in the previous part of it. So that is very crucial. And whenever you're on the stores, appropriate mask wearing technique should be practiced. And I would be discussing that very importantly, because I was actually out there last week out in the shop, and I see a lot of people, there is 50 and 50% of the people wearing a mask and not wearing a mask. And those wearing a mask have been covering only the mouth. And I felt like, oh, is that the guidelines say? Or is it public information being passed on rightly to the people? And is it reaching the people through a right media? So we'll be discussing in the following slides how we need to be wearing the mask in order to protect ourselves and also our community. So the mask wearing, do not leave your nose uncovered. I don't want anyone to actually wear a mask here, because why? The reason is the COVID-19 is a droplet infection. It spreads via the droplets, and when you're sneezing or coughing, or you're through your breathing, you can inhale some other sneezing or coughing, which is danger to you. And when you're sneezing or coughing, that droplets can cause danger to other people. We don't want to do that. So we want to be safer ourselves and also to protect our community. And also, do not wear on your forehead. And the mask is supposed to be wet around in front of your nose, as you can see here. Okay, rightly covered around your nostrils should be covered, and there should be no point of gaps between the bridges of the nostrils. Okay, and properly actually seal to your ears, as you can see in the picture. And also, do not try to wear your mask around the chin. Okay, and no loose fitting of the mask. It should be right fitting for your facial contour, and also make sure that it seals your nose and the nostrils are not exposed. And do not share your mask, which is very important. Okay, so don't actually share, even if it is from your family member. And what is the best mask for you? So there are different varieties of masks available for different people, for healthcare professionals when they are in contact with the public and or the patient, and other the normal simple people who are in the daily public routine, what kind of mask they can wear. It's a very big question. So the best mask, actually, as I go through these slides, and then I'll actually give some few recommendations what we can be using. So the N95 or the similar FFP3 respirators actually are considered to be a good fit of mask and a safer mask, and because it filters out 95% of airborne particles, and it has a tight fitting and allows a minimal leakage. And most of these masks are wear in terms of in the healthcare visiting places, and also by the healthcare professionals. And the respiratory mask N99 FFP3. This is another kind of mask which is also wear, and it's the highest level of protection available, and it must be fitted tightly around the face, and it all reduces exposure to the airborne particles. But what we find is normally in the public, we find the surgical mask, which is being available in a cheaper cost, and a fabric mask covering, which is available in a cheaper cost. Okay, so one kind of guidelines actually recommend that any kind of cloth covering or a fabric mask, which is well tightly fitted, which actually prevents the release of the droplets outside of your facial contact and is correctly sealed, that is okay. But any kind of mask which is loosely fitting for the general public and they're not worn properly, as we discussed in the previous slide, is not going to be a right protection, and you're actually putting out yourself at risk and also causing a risk to your community people. So it is better to wear a right mask. So, and if you're actually wearing a surgical mask, they don't protect against your small airborne particles. And if you're going to use it like for sake of following the guidelines and not covering it properly around your nasal bridges and very loose fitting, that's going to be exposing yourself and the others to a risk. So it would be appropriate to wear a right mask, okay? And what you can do to take care of your lung. So there are a few steps, the normal routine which you can follow to take care of your lung. First and foremost is any of the lung condition makes you feel dehydrated. So be hydrated. A lot of fluid intake is very much important, especially in chronic lung disease people where the mucus production is heavy. And during the process of COVID-19 as well, it's going to exacerbate your mucus production and dry. So it is very important that you keep yourself hydrated with more amount of fluids, especially normal water, or a flavored water with the lemon, or any kind of natural fruit juice rather than going for a concentrated fruit juice that is going to give you real vitamins into your body. So those kind of fluids is good to go for keeping yourself hydrated. And the next thing is to be adherent to your medications and inhalers, whatever the prescriptions your doctors have been given or you're meant to be taking. Be compliant with that. And also during the COVID-19 social distancing, the pharmacies are very, very understanding. So you can bring them and then you can have a virtual consultation and you can renew a prescription. And keeping up with your vaccines is very key, most important. Although we can hear stories about people being double vaccinated with COVID, still having the symptoms of COVID, though that is a fact happening, and we're seeing that those kind of cases in the UK now are more prevalent, especially in the age groups, in the younger age groups and below 50s, from 20s to 50s. So, but this is actually not going to say that, validate the fact that taking vaccine is not useful. Taking vaccine is good in terms of preventing a particular strain of COVID-19 in yourself. And that is very best practice that you actually adhere to the COVID-19. On top of that, the people with chronic lung disease needs to have a flu vaccine regularly every year. And there was a controversy going on whether it is safer to take flu vaccine while taking COVID-19 vaccine. It's absolutely safe to take flu vaccine and COVID-19 vaccine. But if you have any kind of concerns or any kind of other allergies or symptoms, please do discuss with your healthcare provider and choose the right, they would be the right person to provide you a right solution for your concerns of taking both the COVID and the flu vaccine. And the other thing is to be active physically, and virtual pulmonary rehab for chronic lung disease people is a very best choice to go for. And keep in touch with your healthcare provider. There have been different ways of rehab provision around in UK now. Most of them going virtual after the long shutdown during the last year with the COVID. We are actually revamping all the services now and putting more priorities to pulmonary rehab, virtual pulmonary rehab. So get in contact with your local healthcare provider or primary care centers and link in with the virtual pulmonary rehab providers to get started with your virtual pulmonary rehab. And the other thing is normally to be active. Physical activity is a key. and any form of physical activity like normal ground walking or yoga or whatever, the badminton or tennis, whatever you love to do as a physical activity. That is the better way to keep yourself active. And physical activity has many benefits, as you know, and one of the benefits is it improves your lung function better. And it also, because your physical activity also improves your body circulation and temperature in your body, it is also going to improve your mucus thinning. And so the mucus is not going to be dry anymore, and it's going to improve your, reduce your mucus secretions, as well as your mucus is cleared by the movements of your physical activity. So it's very important that you keep your physical activity in continually to the physical activity guidelines as prescribed by your healthcare provider. And also be in contact with your local emotional support provider. So if you're going through any kind of anxiety or depression, higher levels of those might not be best during the COVID-19 challenges as well amongst your chronic lung disease. So be in touch with your counselor or a psychotherapist who is providing emotional support. Or the best way, people who are not having any appointments being booked with a counselor or psychotherapist, get in touch with the British Lung Foundation or the local support groups who provide group sessions of exercises, and that might actually keep you going with emotional support. And the other thing is, if you're smoking, please consider quitting smoking or vaping, because the research has been proved the increased smoking is going to increase your risk towards COVID-19 as well, on top of your chronic lung disease. So please consider to quit your smoking or vaping. And last but not the least, it is very essential that our guidelines are very fluid now. And with the recent increase in the COVID cases, the guidelines might actually be maybe not surprised to have another lockdown, although there's a contemplation of whether another lockdown is needed or not. But it is a very best practice to keep in line with follow the local government guidelines, and keep in with the NHS coronavirus public information link, and keep updated yourself. And in terms of when you need to be calling your emergency, these are the key symptoms you need to be very attentive that you contact your local emergency. If there is an increased breathlessness than normal, or if there is any pain in your chest, or is there any new confusion, or any symptoms or any signs of bluish lips or face, those are the red flags that should actually alert you to call an emergency. So this needs to be very much paid attention to, and your family members should also be knowledgeable enough to identify the symptoms, so that immediate contact at the right time made to the emergency department, and not leaving things to a later to risk. And how long I should self-isolate? So this is another question being posted where people actually are not aware of how long they need to be self-isolating, as there is a difference in guidelines. So people with no immunocompromised condition, at least 10 days from the date of onset of the symptoms. It is not the date of onset or date when you found out that you're COVID positive, but it is from the date of onset of your symptoms, when you identified first your symptoms. That is the date when you count 10 days from there. And so the Public Health Agency have populated this chart here. So if, for example, in a family of two, with a mom and dad and a two child, if a mom gets sick, triggering 10 days isolation for herself and her household. And if the child gets sick after 2 days, because any of the infected person, they put as a risk 2 days before they get infected as well. So the child then gets sick the second day, and the isolation for that child starts from the day when the symptoms appear for that child. And that 10 days is counted from then onwards. and the child to no symptoms, so no need. Still, that is actually the family should be isolating. So when the first person in the family got infected with the symptoms, and that is when the child with no symptoms also ends the isolation as 10 days. And the dad, if the dad has no symptoms but get infected on the 7th day of the first person getting infected, then the dad's symptoms, when the dad's symptoms appear, that is the day it should be counted as the first, and then on 10 days counted, the dad should self-isolate. So this is the pattern of self-isolation, and within the family as well, there should be a 2-meter distance followed if the family, anyone being identified with COVID positive symptoms and a COVID positive test results as well. And what happens for people with the immunocompromised conditions? They have to be self-isolating more than 10 days from the date of onset of the symptoms, and that is a very must. So they should be isolating at least for 14 days to 20 days, so that and also disappearance of all the symptoms before they could actually expose themselves to the public or to the other person in the family who is healthy. So this is how you have to be self-isolating. Hope this is clear, and this is very crucial that it gets to you in the right way, because there's a lot of confusion. What happens if one person in the family gets infected, and what happens to other people, as there was change in guidelines previously, but now the guidelines are very fluid with the rise in the case of COVID-19, and this is the pattern of isolation should be followed. And for more resources, I would actually advise you to check on these links on the slide here. There are good resources from the Patient Information and the British Lung Foundation, European Lung Foundation, and Center for Disease Control and Prevention. So it is very much that we all keep updated, not leaving it to the healthcare providers to inform us and leaving it to the last minute when we get the symptoms to get to know about it. But it is knowledge is rich. And if knowledge is rich, it is better to keep ourselves safe and also protect our family members or a community in a safer place. So we all need to be collaborating and growing together. So in terms of our knowledge about COVID-19, I would people watching this recorded version or just attending this session, I would be more happy if you could check on those links on this slide here. And finally, thank you. And if there is any questions, I would like you to post it on the Facebook group. And our next session is on the 29th of October. And we were actually informing you earlier that this is going to be a fun session, a training session for your diaphragm muscle with a fun device. So the fun device, I actually promised to reveal it this week. And the fun device is your balloons. I would recommend anyone attending the session or anyone who's actually attempting to watch the session and doing the techniques shown in the session to use an 11-inch or a 12-inch balloon. And we will see you there on Friday. And have a good evening, rest of the evening. Bye now.